Patients should expect to feel a little foggy when they wake up. They're going to be under general anesthesia when they come back from the operating room, and then we place them on a medication called Precedex, and it helps them wake up better from anesthesia, but it does make them a little sleepy. So some people wake up and they're able to answer your questions and nod their head appropriately right away, but some people are a little foggier and take a little longer to wake up and come around. But we're usually right in the room with them, and we usually tell them where they are and who we are and what's going on, and we try to tell them that right along so they don't get scared. Following surgery, the patient's family can expect to see a lot of equipment in the room and many tubes. A lot of the equipment is behind the patient, and they have a lot of IVs and a lot of IV pumps. It can be overwhelming. There's a lot of equipment, but we explain everything to them so they're comfortable with it.
The patient will be attached to the ventilator as well as a monitor that displays all of the patient's vital signs throughout the course of their stay. The number one thing a patient can do to help their incision heal is to always use their heart pillow. We ask you to hold your pillow up against your chest and put your arm across and hold your shoulders into squeeze. That not only stabilizes your incision, but it also prevents you from pulling or pushing with your arms, which can put your incision at risk for breaking open.
Patients are generally offered IV morphine on the first day after surgery, and then the next day they'll still have the IV morphine, but they'll be offered Loratab. That's generally what we start with. As patients who are uncomfortable and that doesn't work well, they'll switch to other medications. There's a lot of medications out there for pain, and we'll find the right one for that individual to make them comfortable.
The number one thing I tell patients after surgery is that walking is the one thing that will make them get better. It not only increases their endurance, it helps their blood pressure as well as their breathing. After walking, coughing and deep breathing are the second most important things a patient can do to improve their stay at the hospital. Incentive spirometry not only opens the patient's lungs up after surgery, but allows them to take deeper breaths and get them off oxygen faster. As far as coughing and deep breathing, we ask you to breathe normal, and then when you're doing your coughing exercises, we're gonna ask you to hold your heart pillow and squeeze it nice and tight to stabilize that chest and to allow you to get a very vigorous cough to get any secretions that may be stuck in the bottom of your lungs out. We will start with ice chips, and as the patient tolerates the ice chips, we will transition them to clear liquids and eventually a heart-healthy diet.
The patient will be in ICU for about 24 hours, sometimes a little longer, and then they're moved to the intermediate care unit, which is on the same floor, E2, and they'll go home in approximately 5 or 6 days. The patient will move to intermediate care when they're ready to go. Usually it's the next day, but sometimes it takes a day or two. And it doesn't necessarily mean they're not progressing. Sometimes just a little something that they want to monitor a little longer will keep them in the ICU.